One of the coolest and most exciting thing to me that I'm able to provide for my patients is a crown in one day using CAD/CAM technology. We use our Cerec machine. As opposed to taking an impression, send it to the lab, wait 2 or 3 weeks, have the patient leave with a temporary crown, we're able to scan, mill, and deliver that crown in about an hour and a half. Saves the patient a lot of time and a second appointment. So here's how we make a Cerec crown. We have the patient come in, we numb them up of course, and then we prepare the tooth for the crown. At that point, instead of taking an impression that we would do in a traditional crown that we'd send to the lab, we would scan that tooth with our optical scanner and get a digital model made at that point. As opposed to the lab fabricating the crown out of wax, we on the computer CAD, we can design the crown right then there. It takes me about 3 minutes to design a crown. If the crown doesn't fit from the lab, guess what? It has to go back to the lab and we have to wait another 2 or 3 weeks. These crowns always fit because they're designed with the CAD and there's no distortion on the impression, there's no distortion on the model. Everything is as microscopically fit as possible. So those crowns are milled and manufactured right here on the site. So my computer speaks wirelessly to our milling unit that's in the back room, and from solid block of porcelain, this crown is milled to completion. So within 15 minutes, our crown is done and ready to be cemented. Doing it the other way for 20 years and having the patients literally have their temporaries fall off 4 or 5 times in a 3-week period. It's a nightmare. And the patients are calling in the evenings, weekends, and the poor thing, they're distraught. And we just avoid all that by putting the permanent crown on that day.